Pharmapal. Essential oils in pregnancy. Is aromatherapy effective in obstetrics? A systematic review and meta-analysis. Welcome to today's video, where we dive into the fascinating world of essential oils, EOs, and their potential benefits during pregnancy. This systematic review examines various studies to understand how EOs can affect anxiety, labor pain, and overall maternal well-being. We'll explore the methodologies used, the results obtained, and the implications of these findings. So, whether you're a healthcare professional, an expecting mother, or simply curious about aromatherapy, stick around. Overview of the review. This review was developed by a dedicated team, including Maura D. Vito, whose work is accessible through her Orchid link. The primary focus of this paper is to evaluate the role of essential oils, EOs, in managing various symptoms during pregnancy. Introduction. In recent years, there has been a growing interest in using essential oils as a complementary therapy during pregnancy. These natural extracts are believed to offer various health benefits, but what does the research say? Objectives of the review. Assess the efficacy. The review aims to determine how effective essential oils are in treating symptoms experienced during pregnancy. Evaluate safety. It also looks into the safety of using these oils for expectant mothers. Objective. The primary aim of this review is to assess the efficacy and safety of EOs in treating symptoms experienced by pregnant women. Scope. We analyzed a total of 17 studies, focusing on both clinical trials and observational research, to gather insights into the impact of EOs on maternal health. Materials and methods. Now, let's break down how this review was conducted. Study selection. We included studies that specifically focused on the use of EOs during pregnancy. Data extraction. 3 independent authors reviewed the titles and abstracts to ensure relevance. No direct contact with the authors was necessary. Risk of bias assessment. We evaluated several factors, including sample size, blinding methods, types of data collected, subjective versus objective, statistical analysis. This rigorous approach helped us ensure that our findings are reliable and valid. Inclusion criteria. The authors followed strict guidelines, specifically the PRISMA and MOOS protocols, to ensure a comprehensive review. Here's how they selected studies. All articles published on the use of EOs in pregnancy were considered. Each study was evaluated based on its relevance to the efficacy and safety of EOs. Data extraction. The data extraction process involved reviewing titles and abstracts independently by 3 authors. No direct contact with the authors of the articles was necessary, which streamlined the process. Risk of bias assessment. The authors identified several biases in the studies reviewed, which were crucial for understanding the reliability of the findings. Small study groups. Many studies had small sample sizes, affecting the confidence of results. Absence of blinding. Some studies lacked proper blinding, which can introduce bias. Subjective evaluations. Reliance on subjective data without objective measures was common. Data synthesis. The findings were synthesized narratively due to the heterogeneity of the studies. However, for specific areas like labor pain treatment through aromatherapy, the authors did provide pooled statistics. Results. So, what did we find? Effectiveness. The inhalation of EOs, particularly during the 32nd to 36th weeks of gestation, showed promising results in reducing anxiety levels, as measured by the State Trait Anxiety Inventory and Visual Analog Scale, VAS. Labor pain. Aromatherapy significantly reduced labor pain compared to placebo, with a notable decrease in VAS scores. Quality of studies. Many studies faced challenges such as small sample sizes and difficulties in blinding, which could affect the reliability of the results. Key findings. Strengths. The review highlighted the potential benefits of essential oils in alleviating symptoms such as anxiety and pain during labor. Weaknesses. Limitations included small sample sizes and a lack of statistical significance in many studies. Discussion. In our discussion, we highlight the implications of these findings. Potential benefits: EOs like lavender and rose have shown a relaxing effect, which may help alleviate anxiety and discomfort during pregnancy. Limitations: however, the absence of proper blinding and the small size of many studies raise questions about the robustness of the evidence. Future research, more rigorous, large-scale trials are needed to fully understand the effects of EOs and establish standardized protocols for their use in pregnancy. In conclusion, while the review paper presents promising insights into the use of essential oils during pregnancy, it also emphasizes the need for more rigorous studies. Future research should aim to address the biases identified and provide clearer evidence on the efficacy and safety of these treatments. Thank you for joining us today. If you found this video informative, please like, subscribe, and share your thoughts in the comments below. What are your experiences with essential oils? We'd love to hear from you.
Pharmapal.